Have you ever noticed stiffness in your body that doesn't behave the way normal stiffness should? Not the kind that eases once you start moving, but the kind that lingers, tightens, and quietly changes how you walk or stand. Many people first feel it in the lower back or legs, and at the beginning, it's easy to brush it off as stress, posture, or aging. But what if that stiffness doesn't fade the way you expect it to? What if it starts to interfere with everyday movement, making simple actions feel awkward or unpredictable? For some people, this is the moment they realize something more may be happening, even if they can't yet explain what it is. Before we continue, if content like this from Health After 50 makes you feel more prepared and more at ease, we'd really appreciate you liking this video. To understand why this kind of stiffness feels so different, it helps to know what stiff person syndrome actually is. Stiff person syndrome is a rare neurological condition that causes progressive muscle stiffness and painful muscle spasms, most often affecting the torso, lower back, and legs. Unlike typical muscle tension, this stiffness does not improve with rest or relaxation and can gradually worsen over time. One of the most important things to understand about stiff person syndrome is how the muscles behave. Instead of contracting and relaxing normally, they remain in a constant state of tension. This creates rigidity, reduced mobility, and a feeling that the body is always bracing itself, even when no movement is required. The symptoms of stiff person syndrome often begin subtly, which is one reason it can go unnoticed at first. Early signs may include ongoing stiffness in the lower back or hips, difficulty walking, or a posture that feels increasingly rigid. As time passes, sudden and painful muscle spasms may begin to appear, sometimes without warning. What makes these spasms especially challenging is what triggers them. Stress, emotional upset, sudden noises, cold temperatures, or unexpected touch can all cause muscles to seize. For some people, even everyday sounds can set off a reaction, which adds an exhausting layer of unpredictability to daily life. As these symptoms continue, fear often becomes part of the experience. Many people begin avoiding crowded places or unfamiliar environments, not because they want to, but because they no longer trust how their body will respond. The concern about falling or freezing in place can slowly lead to isolation, even in people who were once very active. Public awareness of stiff person syndrome increased when singer Celine Dion shared her diagnosis. Her openness helped many people recognize symptoms they had struggled to explain for years, and brought much-needed attention to a condition that is frequently misunderstood or misdiagnosed. Understanding what causes this condition helps explain why the symptoms feel so persistent. Stiff person syndrome is believed to be autoimmune in nature, meaning the immune system mistakenly attacks parts of the nervous system involved in controlling muscle movement. In many cases, this attack interferes with a chemical messenger called GABA, which normally helps calm muscle activity. When GABA signaling is disrupted, muscles remain tense instead of relaxing. This helps explain why stiffness is constant and why spasms can be sudden and severe. It also explains why stiff person syndrome is sometimes linked with other autoimmune conditions, such as type 1 diabetes or thyroid disorders. Because the early signs resemble more common problems, diagnosis is often delayed. Symptoms may be mistaken for chronic back pain, anxiety, or other neurological conditions like Parkinson's disease. Since stiff person syndrome is rare, it is not always considered right away. Doctors usually rely on a combination of careful observation, blood tests, and nerve studies to confirm a diagnosis. For many people, finally having an explanation brings a sense of relief, even though it may also raise new questions about the future. Living with stiff person syndrome affects more than just physical movement. Sleep may be disrupted by nighttime stiffness or spasms, and fatigue often becomes part of daily life. Simple tasks such as standing from a chair, getting dressed, or walking across a room can require careful planning and extra energy. The good news is that stiff person syndrome treatment can make a meaningful difference. While there is currently no cure, treatment focuses on managing symptoms and improving quality of life. Medications that enhance calming signals in the nervous system may help reduce stiffness and spasms, allowing for more comfortable movement. In some cases, immune-modulating therapies are used to reduce the immune system's attack on the nervous system. Physical therapy also plays an important role. with an emphasis on gentle, controlled movement rather than aggressive exercise that could trigger spasms. Emotional well-being matters just as much as physical care. Stress is a powerful trigger for symptoms, and learning ways to manage anxiety can reduce flare-ups. Supportive care, patience, and understanding from others often make a noticeable difference in day-to-day life. One of the hardest challenges many people face is feeling misunderstood. On good days, symptoms may not be obvious. On difficult days, they can be overwhelming. This inconsistency can make it hard for others to understand how serious the condition truly is. This is why awareness matters. Early recognition of symptoms can lead to earlier diagnosis and treatment, which may slow progression and reduce complications. Persistent or worsening muscle stiffness deserves medical attention, especially when it doesn't behave like ordinary stiffness. Stiff person syndrome is rare, but it is real. It is not imagined, and it is not simply anxiety or aging. It is a neurological condition that deserves understanding, compassion, and proper care. For those living with stiff person syndrome, progress is often measured in small victories. Standing a little longer, walking with more confidence, or feeling less fear around sudden spasms can all represent meaningful steps forward. With the right support and treatment, many people find ways to adapt and maintain independence. If this information was helpful, please consider sharing it with someone who might need it. And if Health After 50 helps you feel more informed and supported, we would love for you to subscribe. We love hearing from our community. If you or someone you know has experience with stiff person syndrome, feel free to share in the comments. Your story may help someone else feel less alone. Take care of yourself, and thanks for watching.